how's it going everyone? Brent here. Welcome to this newest video. Hope you guys are doing well. As we all know, Moon Knight ended. I thoroughly enjoyed it. And a few videos back, I made this statement. And I am planning on doing a video on Dr. Harrow himself and some of his therapeutic techniques. And that's what we're going to talk about today. One of the things I really appreciated about Moon Knight was the psychological aspects of it. As a matter of fact, it's one of the reasons why I wanted to do a review or I guess reaction videos to it every week, as well as teach a little bit about dissociative identity disorder. And hopefully that was helpful for you guys in understanding this disease and what's actually going on. I did not expect how true to life Dr. Harrow was when he was talking and interacting with Marc and Steven. It was pretty good. My mind was blown, and the culprit, the gentleman who blew my brain is none other than board certified psychiatrist Dr. Paul Puri. And like myself, he is a professor, but he teaches at the University of California, Los Angeles. So Dr. Puri, thank you for lending your expertise to this series. And now let's jump into the video because I want to talk about Dr. Harrow, the psychologist. From the latter portion of episode 4 and onward, the scene shifts to a psychiatric hospital in which Marc Spector and subsequently Steven Grant are patients. They are under the care of psychologist Dr. Arthur Harrow. Just like every psychiatric hospital, Marc is subjected to group recreational activities as well as chemical injections when his behavior escalates. But the forefront of treatment is found in the interpersonal conversations between Dr. Harrow and Marc and Steven. This is where we're going to focus today. Dr. Harrow uses a lot of therapeutic communication. So therapeutic communication is purposeful communication to build and maintain helpful relationships between the patient and the provider. Using therapeutic communication, the provider attends to the patient's feelings, thoughts, needs. He's able to express empathy, obtain information, intervene, and promote functional behavior and evaluate effective interpersonal relationships. Basically, it's communication that expresses empathy and is patient-centered. You'll see Harrow touch Marc, offer him things, and sit beside him. Therapeutic communication is the #1 skill that all psychiatric nurses must have. Not only that, I highly recommend using it with all patients on all units, regardless of where you work. So, how does Dr. Harrow use therapeutic communication? He first acknowledges that Marc is having trouble distinguishing between what is real and what is not. This becomes the central theme for the following episodes as Marc's mind is trying to organize what's going on as he is experiencing things that are not quote-unquote normal reality. Right? He sees Tourette, the boat, the field of reeds. I talked about the organizing principle in a previous video, which deals more with that. So if you guys need a refresher on that, you can check it out. The links are down at the bottom. But the point that I want to make is that Dr. Harrow is reorienting Marc to what's going on. Reorientation is the act of grounding the patient in reality. So Harrow gets Marc to realize that his thoughts are nonsense and helps Steven realize that his mom has passed away. Reorientation can also be reminding the patient of the date and time, where they are, and sometimes it's even saying things like, "You told me you are hearing voices, and I can see that you are talking back to them, but I don't hear those voices." Reality orientation is effective because it can help clear up misunderstandings and false beliefs that the patient has. I use this a lot when I'm dealing with patients who are hallucinating and or having paranoia. Secondly, Dr. Harrow does a really good job of staying calm and patient. He allows Marc and Steven time to express themselves, and he doesn't get upset. The only time there's a change in Dr. Harrow's tone of voice and volume is when Marc's behavior escalates. Harrow does try to de-escalate and calm Marc down by telling him, I understand how you're feeling. I too have suffered from mental illness, breaks in psychic awareness, manic episodes followed by depression. I know what you're feeling. I know you can be healed. What Harrow is saying may be true for himself, and that's may of what happened, to him. But I tell my students all the time, please do not follow this. Do not do this because you may not have experienced manic or depressive episodes or even DID. This type of response does not go over well, and you will get this wrong on the exam because this response is not therapeutic. It sounds nice, but it's not right. Another technique that Harrow uses is redirection. Normally, this is used to redirect patient behavior, but it can also be used to redirect conversation. Marc states that Harrow isn't a doctor, and instead of going back and forth, Harrow agrees and says, all right, I'm not a real doctor. It's not about me. Let's start with you. Retrace your steps. Tell me, how did you come to be here today? Now, Marc blows off the question and asks Harrow how he got here today, turning the tables on him. Harrow responds that he took the bus, then redirects it back to Marc. You want to know what you told me about how you got here? You told me you were in a place that oddly was reminiscent of this office, except it was in Egypt, and you were with a rhino. Immediately correcting him, Marc states, hippo. Too good. So I hope you guys were able to see in that scene, Harrow was talking to Marc. Marc redirects it back to Harrow, trying to make it about him. Your job as a psychologist, psychiatrist, the nurse is to focus on your patient. Remember, therapeutic communication is patient-centered. So Harrow answers Marc's question, tells him he came through on the bus, and then redirects it to ask him, do you know how you got here today? And this conversation was able to spark Marc remembering or recalling that he was with a hippo, not a rhino. This is exactly what you want. This is the chef's kiss. This is too good. This is great stuff. Therapeutic communication is not about you. Redirect and deflect it back to the patient. Now, this is where things start to hit a little bit of a gray area. Students ask me this all the time. Hey, Brent, if I acknowledge that the patient is hearing voices or believing that something isn't true, would that mean that I'm feeding into it? For example, if a patient tells me that they're being chased by the FBI, and I ask them to tell me more, am I feeding into their paranoia? Answer, not necessarily. Yes, you are encouraging the patient to share their thoughts, their feelings, and their beliefs. That's perfectly fine. But now you're gonna have to do something about it. I tell my students this, for every problem you come across, there has to be an intervention. Remember ADPI, that's part of the nursing process. You see a problem, you have to address that problem with the solution, and then you come back later to evaluate that solution. Here's the intervention. You can tell the patient this, I hear you. I can see you're worried about the FBI coming to get you, but you are safe here. This is a hospital and not just anyone can come in here. If you don't want anyone to know that you're here, we can do that. Do you think that we can do something to help you relax? We can get you food, we can go take a walk, we can go watch TV in the day room, I can get you medications, right? This is me offering now a solution to help the patient because he's kind of anxious and turned up about the FBI coming to get him, right? So now I'm hoping to de-escalate the patient, to bring him back down to some sense of calmness, baseline, I guess, if that is the patient's baseline. Of course, there's still the problem with the patient having these false beliefs, this paranoia. What's going to help with that? It's medications. And as I said in an earlier video, medication management is the backbone for acute psychiatric nursing. So there it is, you guys. Hopefully this helped you understand therapeutic communication a little bit more, and also helped you give you some tips to deal with patients. Super important skill, number one skill. Please use this skill. Doesn't matter if you're working in peds, emergency room, mental health. Therapeutic communication works. You can use it not only for the patient, but also with the patient's family members. So use it. It works. It's great. So if there are no comments, questions, concerns, or complaints that can be expressed in a therapeutically communicative manner, don't forget to like this video and subscribe to the channel. If you guys do have any comments, of course, let me redirect you down to the comments section below. Let me know what's on your mind. And I will catch you guys next time. Thank you for joining me today. Peace.